Hi everyone, it's John from Tiny Tickers and I would like to ask for your help. Tiny Tickers is a small national charity working across the UK to help save the lives of babies that have life-threatening congenital heart disease, and we also work to support their families at a time of crisis. Now, over the last few years, we've built up our family support services and we're really proud of the impact that we have. We can offer people all sorts of support work. Now, this really resonates with me because my own daughter was born with a life-threatening heart condition. And 18 years ago, when we found out about that at our 20-week pregnancy scan, I remember myself and my wife coming out of the hospital and we were just absolutely shell-shocked. The way that we've described it is getting that news is like being hit by a juggernaut. I remember we sat on a bench just outside the hospital doors and we just didn't know what to do. We didn't know where to get new information. We didn't know how to connect with other people. We felt so alone, so isolated. And that's because none of this support work existed. Now, over the last few years, Tiny Tickers, we've been so proud of the menu of support work that we've built. So now, if a family gets a diagnosis, they can be straight onto one of our Facebook groups and interact with literally hundreds of other heart parents who are going through similar things to themselves. They can order a support pack from us and they'll receive loads of information that they can trust, that they can rely on, lots of advice, lots of materials in there that will help make their journey that little bit easier. They can sign up for a support group, so within hours they could be attending one of our pregnancy or one of our newborn support groups that are facilitated by health professionals and allows them to link with peers and to build relationships and to really talk about what they're going through. They could go on our website, watch our webinars, they could read information about the conditions that their baby has. There's so much support that they can get, and we've built that up over the last number of years, and we're just super proud of that. However, we've got a challenge. Like any charity, like any organisation, and indeed like any household in the UK, we've got a problem in that our costs are rising. The costs of delivering all this work are getting larger and larger and larger. And at the same time, our income from our fundraising has stagnated a bit. It's kind of stayed the same for the last few years. And that means that we're currently operating in a deficit. So it's costing us more to deliver all of our charitable activities than we're raising. And now in the medium long term, that's going to become a problem for us. So what we're really doing with this appeal is just asking all of our supporters to be as generous as they possibly can. And no times are tough, as I just said, for everyone. But if you can support us, that would be absolutely fantastic. Now, in the future, we're going to be having to make some decisions about what services that we can continue with. And we want to make sure that it is every single one of them. We do not want to take away anything that we're currently offering those parents, those families that have been suddenly thrown into the world of congenital heart disease. We don't want a single family in the UK that has a diagnosis of congenital heart disease to not be able to access all of the support that we offer. I'm super proud of the fact that over the last few years, I can't think of a single situation where we've had to turn a family away, where we've had to say, sorry, you can't attend one of our support groups, or sorry, we can't send you this support pack. It would break my heart, sorry, no pun intended, but it would break my heart if we were in that position. So if you can, please do give generously to our appeal. And I thank you so much on behalf of not just all of us at Tiny Tickers, but more importantly, on behalf of all of those future families that are going to need our support in the coming months and years. Thank you so much.